Welcome to the first episode of Season 4 of Coming Together for Sexual Health. Thanks to our Community Advisory Board suggestion, this season will be comprised of mini-series, 3 episodes each on a particular theme. We start off with a mini-series on harm reduction, then family planning and reproductive justice, followed by pleasure. Make sure to follow us wherever you listen so that you don't miss an episode. Enjoy! Coming Together for Sexual Health engages you in shameless conversations about sex-positive, identity-affirming sexual health care. We keep our attention on those most impacted by STIs, HIV, and structural barriers. We're powered by nationally recognized experts in sexual health at the University of California, San Francisco, and the California Prevention Training Center. All views expressed are those of the person speaking and not of the CAPTC or their employer. My name is Tammy Kremer. Let's come together for sexual health. Welcome to Coming Together for Sexual Health, Kochina Rude. So glad to have you here today.
Thank you so much for having me.
Kochina Rude is a Bay Area-based drag queen, harm reduction advocate, and public health worker. She co-hosts the drag show Princess with Lisa Frankenstein at SF Oasis, which I got to see last weekend, where she established a naloxone distribution and overdose prevention education project for LGBT plus nightlife, providing over 2,000 doses of Narcan for community members in San Francisco's South of Market neighborhood since 2021, which is a huge number of doses you've been able to provide to the community alongside the other educational work you've done, which I look forward to diving into. And this interview is the first of a 3-part series we're doing on the connections between harm reduction and sexual health. And I just want to say a little bit about why we're spending so much time on harm reduction on a sexual health podcast for our listeners. So these issues are interconnected on many levels, and I'm going to share a couple, and I'm sure more will come forward. We want to look at the whole person and knowing and understanding that issues of substance use and sexual health impact a lot of the same communities that experience inequity and stigma. So communities including queer people, people of color, and sex workers that are dealing with issues of, like I said, stigma, disproportionate numbers of infections, sometimes lack of access to treatment, and issues of policing and incarceration. Another kind of connection we have is that harm reduction is a grassroots movement. It grew out of a community of people who use substances and those who love them, to non-judgmentally support folks who use substances and provide resources, and to help people basically make the choices that are most aligned with what their own personal goals are. And we'll hear more from Kochina soon about your definition, and I look forward to adding to that. And this philosophy is something that's also since been applied to other areas of life. And sexual health is one of those areas of how can we support folks when it comes to making choices around their sexual health. And last, I just want to say that for us at this podcast, we're really focused on reaching providers, reaching advocates, and a lot of the places where people seek treatment around sexual health are also those same places where people could go to get treatment around harm reduction with substance use. We've discussed harm reduction on previous seasons. Look for that episode on sex, drugs, and rock and roll with Jen Jackson. So one last piece of introduction here is that for this series of 3, we're going to be using the ecological model. And we're going to be moving from the individual personal level to the interpersonal or social level, and then finally to the contextual and structural level. Of course, all 3 of these, the personal, social, and structural, are interconnected and inseparable in many ways. But to give us a little bit of a framing, today we're going to be starting with that individual or personal level, given that, Kochina, you have been working on these issues from a very personal place and incorporating it into your platform as a performer. I had a great time at Princess this last Saturday. It was super fun. The crowd was really awesome. Just really good vibes. Your co-host and the performers were on point. How was the show for you this last Saturday?
The show last Saturday was fantastic, and thanks again for coming. This is what we do every single week. Often these shows are fabulous and a bit of a blur, and sometimes I don't remember what happened at what show but the crowd was really great last week. Our guest performer was phenomenal, and I just have such a great time on stage with my co-host, Lisa Frankenstein. We're known to be something of a pair with each other, and so it's great to have that connection and rapport with another person and provide that kind of dynamic hosting style. I think that it keeps the audience engaged rather than just having me up there shaking my fist about harm reduction to people. And it's nice to have some levity.
Can you describe a bit about your style as a drag queen?
My drag is inspired by other people who were touchstones in my life. I would describe my drag as DIY Chicanx or Chicano. I identify as a indigenous Californian. Growing up, I was inspired by the Latina Chola girls, the Pachuca girls, the really sharp eyeliner and eyebrows and lip liner and bad attitudes, walking the mile in PE class and punk rock chicks as well. Those two types of women who I was around when I was a teenager just really inspired me because they were tough, they were strong. Hard femme is how I would describe it. Just really playing with that idea of like looking really kind of pretty, but having a really tough edge to it. The DIY aspect is I sometimes use unconventional materials. I make drag my own way. So DIY for me means not just the literal sense of building and creating things from scratch, but also the positive mental attitude of, you can do anything yourself. And that's something that is at the heart of what it means to be a part of the punk community.
Yeah, I'm just reflecting on how that also might show up in how you advocate for harm reduction in your work as a drag queen.
I say this all the time. When I started doing harm reduction work as a drag queen, I didn't ask permission from anybody, except for, of course, Darcy Drollinger, who's the owner of SF Oasis, which is where the show occurs. I just was a trainer and distributor for the San Francisco Dope Project, which is an amazing organization. It's part of the National Harm Reduction Coalition. I just had the idea one day to start giving Narcan to people. I didn't check in with the health department. I didn't check in with like any other organizations that were doing harm reduction work. I just saw a need that was not being addressed among my community. So I just decided to do it. I made it up as I went. I'm not a nonprofit. I'm not an organization. I'm just a person. And I had resources to provide harm reduction education and literally like Narcan and fentanyl test strips to partygoers. And so I'm committed to that.
I'd love to hear a bit about that personal aspect of how you came to working around harm reduction.
Sure. I started working in harm reduction about 10 years ago. I was an intern at a HIV and AIDS nonprofit in Sonoma County, actually called Face to Face. They still exist. I think they do fabulous work. So I was an HIV test counselor, a test counselor for Hep C as well. I would test participants who may be experiencing homelessness, people who use drugs. I also tested people for HIV and Hep C in the local jail. And so, really, just had that experience working with community members who are historically disenfranchised or not treated very well by the society and the world that we live in. As a teenager growing up in Sonoma County, I was a drug user and truant and all these things. And, I managed to graduate with a bachelor's in sociology and women's and gender studies from Sonoma State University, but I always kind of disidentified with the way that the world told me to do things. And so I always felt like I should do things on my own terms in my own way.
I'm wondering if you can share with us about a time that you really realized how critical this work is.
When I was a teenager, I was gay, person of color. I didn't really have resources for my own sexual health. The answers that I was looking for weren't really available to me. Mind you, this wasn't even that long ago. This is in the early mid 2000s. And I didn't have a lot of queer people to look up to who were role models. I have a great relationship with my family and my parents, but I just don't think that they had the resources available to them to be able to provide the help that I needed. But I want to say junior year of high school, I went to a local free clinic for teenagers and young adults. It was my first time getting tested for STIs without my parents knowing. I thought I had a STD, and the physician molested me during my tests. And so since then, I am committed to making sure that people don't experience that because I was taken advantage of by someone. And
Wow.
fortunately, I was able to advocate for myself in that scenario. It took me many years to kind of look back and realize that that's what really had happened. And I became an HIV test counselor for the purpose of ensuring that that wouldn't happen to people. So I came into doing harm reduction work related to sexual health. My understanding of how harm reduction and drug use and sexual expression all kind of mixed together. And I managed a sexual health program at St. James Infirmary, which is a nonprofit in San Francisco by and for sex workers. It's the only one in the country that's a peer run clinic for people who engage in sex work. And I oversaw the HIV, Hep C, chlamydia, gonorrhea, syphilis testing and outreach. Through that work, I became familiar with overdose prevention and drug stuff. I worked at the needle exchange every week. I talked to people who injected drugs, people experiencing homelessness, and I learned a lot. And that is something that I've been able to take with me in my work today.
Wow. Just gonna hold space for all of that. Thank you for sharing your experience. And it's incredible to also take that experience and then utilize the motivation to create a better reality for other people. Yeah, what is, if you could give us your definition of harm reduction?
It is ever changing and it means something different to everybody. It's kind of like punk to me. For me, harm reduction is a philosophy developed by and for people who use drugs for the purpose of centering their own agency and their own rights to access health that they deem appropriate for themselves, rather than having the world, the institutions at large, doctors, medical professionals, etc., tell them what's best for them. So harm reduction is all about you knowing what's best for you and your health, and you being trusted to make choices on your own behalf and be a self advocate, and that you're the expert of your own experiences. Harm reduction as a term is used for a lot of things now, and it's part and parcel with sexual health as well when we talk about it today. But I do like to remind folks that it was a term coined by drug users and anarchists.
And was there another story that you wanted to share that we didn't get to in terms of how you got more invested in doing harm reduction work?
So a few years ago in 2021, I was performing at Folsom Street Fair as a drag queen. Folsom Street Fair, for folks who may not know, is a internationally recognized leather and fetish street festival that happens in San Francisco's South of Market district. It's a celebration of freedom of expression for people who engage in alternative forms of sexuality and sexual expression and gender expression. I have a few friends who live on Folsom Street proper, like literally on Folsom Street in Soma, and they were having a like house event for people who were attending the street fair, and it was like not like an open to the public type of thing. It was a house party. And so after I performed at the fair, I went to my friend's house. It was probably like 5 p.m. I was completely sober. There were people milling around in like this little backyard area. There was a DJ, and a lot of the people there were people in my community, and so I recognized a lot of people who were at this event. Suddenly, in the midst of this very lighthearted, cute event, somebody drops to the ground, and I see that they are white in the face, that their lips are blue, they don't appear to be breathing, and I recognize this immediately as an overdose, specifically an opioid overdose. There are some other folks at the party who tried to respond by doing some chest compressions, but I realized that nobody really knew what to do in the case of an opioid overdose. All of these really brilliant, amazing, smart, beautiful people were not getting the information that they needed to be able to respond to an emergency like that. And that was when the realization really hit me. Fortunately, we were able to revive the person. My friend Beverly Chills, who was the DJ, she's also a drag queen, a dear sister of mine. She had Narcan in her purse. And so she was able to give it to me. I administered it on the person. We did rescue breathing, and we gave them a second dose by the time emergency medical services arrived. But by then, the person had started to come around and was breathing again. So it was a win. A week later, we were giving away Narcan at the club.
Wow. What did it take for you to get that going?
I'm a trainer with the Drug Overdose Prevention Education Project called the DOPE Project here in San Francisco. So, I emailed my contacts there. I said, hey, I'm going to do trainings at this drag show. And so they said, okay, great. We trust you. Go for it. And so they provided me a case of Narcan every week. Until now, we have not missed a single week since.
Wow. And who do you feel like you're able to reach through this project that might not be reached otherwise?
Well, people in the nightlife queer community who are drug users, who may not see themselves as drug users necessarily because they don't use what we might call hard drugs like heroin, methamphetamines, etc. And weekend warriors, people who let loose on the weekends, maybe they're doing some cocaine, some ketamine, Molly, etc. I am never going to say that I'm doing anything new. I stand on the shoulders of many, many people in harm reduction community who have taught me and who have been doing this work for many decades. The San Francisco Department of Public Health officially adopted a harm reduction policy stance in the year 2000 as a result of the work of activists at syringe exchanges and advocates in San Francisco in the 90s. I'm just repackaging the same information to a new audience because that audience had not necessarily been vulnerable to opioid overdoses. With the emergence of street fentanyl in the greater drug supply, we're seeing more opioid overdoses among people who historically do not use opioids.
Yeah. I was also thinking about the kind of overall rise in overdosing in the last number of years, given the COVID pandemic. It sounds like you got started with a specific project into the pandemic in 2021. But have you noticed that in like your work, any change between pre-pandemic and pandemic?
The data is there in terms of like how many overdoses, fatal overdoses specifically, we're seeing in San Francisco and the Bay Area and across the whole country, steadily increasing since 2016. In 2017, I was doing HIV Hep C rapid testing at a needle exchange. And I had a participant come in and tell me that he was selling fentanyl. I just knew that people were overdosing and dying because of this thing called fentanyl, right? And fentanyl itself is not a new drug. It's used in hospitals for pain management for a long time. And so there are street versions of it that are unregulated because of the war on drugs. But this participant at the needle exchange drop in told me that people who use opioids, this is in the Tenderloin, when they were learning of a particular batch of drugs resulting in numerous overdoses, they say, oh, well, that's the good shit. I want to get my stuff there. And that was when I learned that the problem of fentanyl contamination in the greater drug supply is far more complicated than I had realized. And, people use fentanyl on purpose. People purchase fentanyl on the drug market just like every other substance. And so just because people use fentanyl intentionally does not mean that they themselves are bad people. It doesn't mean that they themselves have bad intentions. There are people who use fentanyl safely. And, I think that they deserve support regardless of what substance that they're using. What I'm trying to do is I'm trying to prevent fatal overdoses in my community. There's no point in pointing fingers at what we perceive to be the problem, like fentanyl dealers. Because at the end of the day, it's the United States war on drugs that is the problem. It's the society that we live in. It's because there's no safe supply in this country. We need to open injection sites, decriminalize drugs and drug users, and that's the only way that we're going to see things change for the better. And I think that what is important for us to do as a community is to have the tools to react to things that are inevitable. I want to focus on what we can do about it.
Yeah. And how do we take that stigma away and look not just at the individual people and the choices that they're making, but like look at the society that we're asking folks to survive in? Oh man. Being human.
It's a rough world out there.
Seriously.
Highly
I mean, can't we
overrated.
just put on our spacesuits and stuff?
Well, that's why I'm a drag queen. It's like my spacesuit.
Mm-hmm. Can you say more about that?
Well, as a drag queen, I have found that my advocacy and my ability to make an impact on the topic of harm reduction and overdose prevention has just been way more effective. I have literally like a character that I can channel a lot of this stuff through, and people will listen and pay attention to a drag queen. People don't want to like go to a club and then listen to me just like in a t-shirt and jeans. So the thing with drag is that it elevates everything around it. It elevates the energy in a room when a drag performer walks in. And I've been inspired endlessly by drag performers since moving to San Francisco in 2014. My drag mother was Fatima Rude, who, may she rest, was a very, very well known and controversial drag queen in San Francisco for a long time. She was a punk and she did things her own way too. And that's what inspired me, drew me to her. And I try to live on through her by doing things my own way. Being a drag queen has also been helpful for just being social. And since I stopped drinking, I'm not as social as I thought I was when I was a person who consumed alcohol. And so I had to kind of relearn how I interacted with the world. So I found that increasingly Kochina Rude was my armor. The late Heklina, who passed away, may she rest as well, she said the same thing in an interview. She said that getting into drag was like putting on a suit of armor. And I definitely feel that way. I feel invincible when I'm Kochina. I feel like I can do anything. I feel like I can say anything. And so if I have this power and this platform, I might as well say something useful, you know, with some tongue in cheek humor, with some levity. People don't go to a drag show for a lecture, they go for fun. And they're also drinking and using drugs themselves. And so they're maybe not have the attention span for a speech that's longer than 4 or 5 minutes. So
I have a question. Would you be up for giving us your 4-minute spiel that you give at Oasis?
So what I do at the club is, try to make it really relatable. Okay, everybody. So what does Narcan do? And a lot of people usually say that saves lives. And I just go, okay, yes, it saves lives. It reverses an overdose. And then sometimes I'll say, how many people have heard of fentanyl? And then people boo. And then sometimes I get to say, well, there are people who use fentanyl and they use it safely. And we're not here to shame drug users, are we? And then the audience goes, no. And I go, okay. So let's say you are at the club and you and your friend Becky go into the bathroom and you decide you need an upper. I'm just going to say that, right? Let's say you didn't test it first or you don't know, you got it from a new place. And Becky suddenly, does a bump. And then a few minutes later, Becky her breathing starts to falter. She starts to become non-responsive. She's slumping over in her seat. And next thing you know, you have an overdose on your hands. Everyone say, oh no, Becky. And then we go, okay, so what do we want to do? How many of you have a cell phone? And then people raise their hands. I'm like, okay, well, that means that you can call 911 in the state of California, as there are in most states. There's a Good Samaritan law, meaning that if you are acting in good faith to save someone's life, you can't be cited for using drugs yourself in that situation, right? So don't let that be a deterrent. Now, while your friend is calling 911 for you, it's time to act, baby. We're going to use some Narcan. So then I just show them, this is the nasal spray container. You just take it out of its packaging, super easy. If you've ever used Flonase or allergy medication up your nose, you can use this. You use the whole thing up their nostril. Narcan takes 2 to 5 minutes to work. 2 to 5 minutes is a long time when someone's not breathing. So what you want to do in the meantime is you want to lay Becky flat on her back, lift her chin up, and pinch her nose. And guess what? You're going to give her life, aka rescue breathing. So 1 regular sized breath every 5 seconds. And Becky's going to come around. Just in case, it's been 5 minutes, you're scared, you have more Narcan, you can use it. More Narcan won't hurt her. It can only help in this situation. If someone hit me with 10 doses of Narcan right this second, it will do nothing to me. Becky's going to come around and Becky will live to party another day. Everybody say, yay, Becky! And they go,
Yay,
yay,
Becky!
So that's how I try to talk to nightlife goers about it. I might say something different if I'm talking to a room of opioid users, because then you have the withdrawal aspect and then you have the police and all that stuff too. There are lots of amazing people doing that work as well in San Francisco. So I'm just trying to cater it to my community.
That's a beautiful way to bring it in. What a gift for that person to be ready to save Becky's life.
Yeah, we want to save Becky. Becky's the heart of the party, man. You gotta support Becky. All those Beckys out there, we wouldn't be able to have fun without you.
Yeah, we need her. Now we're going to take a quick break from our episode to pay tribute to a harm reduction hero who has passed on, which we'll be doing in each episode of this mini-series on harm reduction. Here's Jen Jackson, a harm reductionist and capacity builder at the California PTC.
So one champion of harm reduction that I would like to remember, though I can tell you that they are completely unforgettable, is Mark Kinsley. Mark and I were on the board of the Austin Harm Reduction Coalition years ago when I first moved to Texas. And I really enjoyed working the van with him and just being around him and watching him engage with individuals without judgment to provide them the care and services they needed and link them to the additional services they needed, depending on their needs in the context of their lives. Harm reduction right there. He met people where they were. You know, he was a founding member of the Texas Harm Reduction Alliance and the Texas Overdose Naloxone Initiative. And he also worked with SAMHSA, which is the federal agency that leads efforts to address substance use and mental health, to build curricula around overdose prevention. I can tell you one thing, public health and harm reduction is better off because of Mark Kinsley's contributions and advocacy.
Thanks, Jen. And if you haven't listened to Jen Jackson's episode from season 3, episode 2 on sex, drugs, and rock and roll, be sure to check it out. When you were going through your own process around your choice with alcohol, I'm curious if harm reduction as a philosophy, like how that interplayed for you.
Well, it's funny because, I had been doing harm reduction related work for many years before I really had a serious look inward around my own alcohol consumption. And, I am someone who would write off my excessive drinking as harm reduction. I was like, well, I'm a person in the community and I'm doing me and everything's fine. I'm able to get my work done and all this other stuff. But, the pandemic really, I think, forced a lot of people to look internally at their habits and their lifestyles and reassess things. And so that's definitely what happened for me. I'd been a daily drinker since I was barely even legally able to go into a bar. So to give up something that had just been almost part of my personality, for such a long time was a lot harder than I thought it was going to be. But I managed to do it. I'm not someone who can moderate, unfortunately, for myself when it comes to my own alcohol consumption. And so that was a hard thing that I had to face because it kind of went against the principles that I had teaching people. For me, abstinence from alcohol is what works for me. I'm not saying that that's like going to be the case for the rest of my life. Since I stopped drinking, everything in my life improved. At the same time, other people are perfectly capable of being able to moderate their substance use, regardless of what the substance is. And I think that those people deserve just as much support. Harm reduction and managed substance use is a spectrum. It's not either or. You don't have to be abstinent straight edge forever. You don't have to be a sometimes user forever. You don't have to be a chaotic user forever. You have to believe that people know what's best for them and can make their own choices, and that people, most importantly, are able to change their behavior.
Is there anything else that you'd want to share on this crossover between folks that are choosing to use substances and how folks are managing their choices around sexual health?
I actually work for the STD control branch at the California Department of Public Health. So this comes up a lot in my work, and a lot of it is justifying this relationship between sexuality what people do in the bedroom or for money or whatever the case may be, and their substance use. It's all about drugs, sex, and rock and roll, baby. And so it's hard to talk about one thing without really talking about the other. Harm reduction as a way to prevent communicable diseases is really, really where it is for me. I feel very passionately about people's right to sexual health and access to sexual health care that's competent, that's trauma informed, that is harm or risk reductive, and that is empowering for the individual. Right now, we're in the middle of a congenital syphilis endemic. There are lots of people living undiagnosed with hepatitis C, which is another disease that is not typically transmitted through sex, but is prevalent among injection drug users. And like, we're never going to get anywhere unless we talk candidly and about what behaviors cause what risks and how people contract communicable diseases. People are afraid to go to doctors due to discrimination. People are afraid to seek competent healthcare. There are health jurisdictions and organizations that close their doors to people depending on whether or not they have a certain kind of insurance, or what if they have Medi-Cal, or if they're homeless, right? And so we're just never going to see an end to it unless we have a serious look at how much negative stigma for drug users and sex workers and transgender people, et cetera, et cetera, et cetera, impacts communicable disease transmission. And then you also have people who, maybe don't see themselves as promiscuous or see themselves as very traditional when in regards to their sexuality and their substance use. And yeah, they may contract communicable diseases and then feel intense shame and stigma about it because nobody ever actually sat down and talked to them and said, it's okay, most people get this. I've had almost every STI that you can imagine, sometimes multiple times. I think that qualified me just as much for my job as my degree. And so, really bringing that on the ground experience and that perspective into bureaucracy, I think is much needed. There are lots of people at high levels of decision making who have no idea how things actually are working out on the ground. I can write a fancy email, I can talk fancy, I can do all those things, fortunately. But there are people who can't. And just because they can't talk a certain way to a medical professional doesn't mean that they don't deserve competent healthcare.
Yeah. And I'm just thinking about how you are able to hold both of these worlds, like this kind of like public health industrial complex alongside like drag nightlife, and the kind of translation that must go on in between those different environments, and how your work in one sphere might impact your work in the other sphere and vice versa.
I'm the connector between those worlds. It's me, right? But I actually do try to make a very clear delineation between what I do for work and what I do outside of my work at the STD branch. And this is also where, I must disclose that anything that's discussed here is not reflective of the STD control branch or California Department of Health. The reason why I'm here talking to you is not because of those activities, but because of my harm reduction related work as a drag performer and local character. So my opinions are my own, my perspective is my own, but I think that people with this perspective are valuable in the greater public health atmosphere.
Yeah. And for those of us in that greater public health atmosphere, what are some things that you think the public health system could do better or differently in order to serve the queer community and the sex worker community?
I am so glad you asked me that, Tammy, because so often have I been in meetings where people discuss certain demographics based around social determinants of health as though that they are theoretical or statistical. And there have been times where I've been sitting in a work meeting and fully felt triggered with my fight or flight thing because I've lived so many of the experiences that people are speaking of in a fashion that is like othering. For some of us, this is not theoretical or not purely statistics. Our work is informed by those things, but sometimes the person who represents these communities is sitting in the room with you. Sometimes these people who have these lived experiences are the people who you are actually talking to. When you speak of like Black transgender people, when you speak of gay men who use methamphetamines, when you speak of people who experience homelessness, have these discussions as though someone of that demographic is sitting in the room with you.
That's very, very humanizing. I think there is this ability to kind of get theoretical, like you're saying, like talking about folks in this othering way.
And that goes back to the philosophy of harm reduction at its core. It's about humanizing people and centering people first, using person first language. What would a member of this community, how would they refer to themselves and each other?
So I like to close with a little bit of imagination, inspiration, recognizing that imagination is a critical part of movement building. And, as a drag queen and artist, I think that seems like it's a part of that work already. But what's one thing you imagine we can create by coming together for sexual health?
We can create a lot of opportunities for great sex.
Yes. Love it.
It's all about living happy, living healthy, doing what you got to do in the moment, doing what you got to do after the moment. But most importantly, lift each other up. Don't push each other down for things that they enjoy.
I love it. And where can our listeners find you?
I'm on Instagram as Kochina Rude, all one word. It's spelled Kochina, like the Spanish word cochina, but with a K instead of a C. And then Rude, Rude. My work has been featured in 48 Hills, LA Times, in the Wall Street Journal, and the local CBS news as well. And so I just am very grateful for this platform and every platform that I've been given to speak on this subject and spread the word to protect my community.
Well, thank you so, so much, Kochina Rude, for coming on and speaking with us. And something I'm taking away from this conversation is the way that you are grounded in both your personal experience and also really draw on the folks that have come before you and bring that forward into your work. And again, I had so much fun at the show, and I encourage our listeners, if you're local, head to Oasis on Saturday night.
Yep, the party is called Princess every Saturday night, and sometimes we have special guests, we have theme nights. It's a lot of fun. Get your tickets in advance. Don't miss it.
Thanks for listening, and please follow and rate us wherever you get your podcasts. This will help more people find us. Check out the show notes for the resources mentioned in this episode. You'll also find a link to the transcript of the show. Connect with us on Instagram at Coming Together Pod, on Twitter at California PTC, and at comingtogetherpod.com. This podcast is produced by me, Tammy Kremer, and is edited by Isaiah Ashburn. Thank you for coming together for sexual health.